Alright, so now this is going to be a video on our implant kit setup here. So all of this is on a cart that we'll keep in a separate room. We do have it organized with all of the cords, and we'll kind of go through where we're going to store all this stuff for you when you start to set it up. Here we have our foot pedal. So this is going to attach towards the back of our motor here, our unit, and this is all labeled in the back as well. So as you can see, it does have that cord. This is pretty self-explanatory. You're just going to line it up. You do want to be cautious because these little pins in there, we don't want to be breaking any of those off, so we want to be cautious putting that in. So we'll want to make sure it fits correctly. Turn that in, just needs to be hand tight there. Perfect. Turn that back around. Next thing we'll do is plug in our motor. So we have our motor here. This is what it'll look like, and it has a very similar end to the foot pedal end. This one is going to go into the front, and this one is very clearly labeled here. It says connect motor first before powering on. So we'll connect that on there. Same thing, be a little delicate while plugging that in. Perfect. And then it will sit on this little pedestal here, so we can just lay that down for now. Next, we're going to plug in the unit itself. So this black cord is what we're going to utilize. And it's just going to come towards the back of the unit. There is a specific spot for it to be plugged in back here, right next to the power switch. So we'll plug that in, flip it around, plug it in, and then most of the time that switch will be on set to off on the back here. So you're just going to want to flip that once plugged in. We'll flip that to on, and it'll set up. Now this is already preset by doctor, so you don't need to worry about any of the speeds or the torque, anything like that. She will adjust that herself if she wants to change that out. So next we're going to do is put in our saline holder here. So that's going to set up right into there. It's got this little hook, and then we will attach our saline bag. So that's going to come on here. So this end, there are little packs that we have. So while we're setting this up, these are the bags. They're going to be stored on the cart as well, and I'll show that cart in a minute. This is what we're going to utilize, but for just teaching situation here where we had already opened one up, so we're not going to open up another one here. So this one is already open. So what you're going to do is grab the bag itself. There is a little plug that would normally be in here that you're going to take out, and then you would open up your cassette. There's going to be a cover that is on the top of here, this pointed end, and you're going to insert that into the bag.
Bye, Brittany.
Bye. So we're going to want to make sure that that is pushed all the way in. Good. And then we'll hang it up on the end there. Perfect. So we want to make sure at all times before we hang this up, we want to make sure that this is closed. Otherwise you will get some water leakage that's going to come through here, same as like an IV bag. So make sure that this is set to off, and you can just kind of mess with it and feel, turning it one way, you'll feel the pressure, and that means that there is no gravity being force fed down. So then we will grab our end here, and we're going to insert it into the back of the machine. So with this, it can be a little tricky from time to time. You do have to mess with it a little bit. We want to make sure that we always test this before the patient is seated and ready to place the implant. So we'll force it into the back there. It is the thicker end. There's a thin end, and then there's a thick end. We want the thicker end put in between there, and then we will turn this to closed. Perfect. And then when we have everything set up, we will test to make sure that the water will run through it fine. I'll turn that over. So next thing we're going to do is run this line, and we're going to connect it to our handpiece here. So there's a little nozzle that you're going to slide that into on the handpiece itself, the other end of that line. Perfect. And then we're going to attach the handpiece to the motor that we had set up earlier. Good. And now we have these little blue pieces here that we're going to attach just to make sure that this line isn't going to be flopping around as Doc is placing her implants. So we put the bigger end onto the motor hand itself, and then the little end, the IV cord will attach to that. You're going to go down all the way down the line here with those. So with these little blue pieces that we are placing here, we want to make sure that those do not get thrown away. These need to be sterilized for every procedure. So we want to make sure that we're keeping an eye. We can count them before and after as well, just to make sure that none are missing. As far as the line itself to the bag and the line all get thrown away. Those are disposable. Everything else is not disposable, so we want to make sure we're keeping an eye on that. So once we are done getting that set up here, we have it turned on. We're going to open up our saline bag. You'll be able to see the water start to drip down there. And then what we're going to do is just test our bag to make sure that we are getting good flow through. So what we're going to do is grab our handpiece, and usually we can run it over here. And we're just going to just run it a little bit, make sure that we got water coming through. And we do. So you get a nice stream like that. That means that everything is set up correctly and ready to go for the implant.